About the common indications in shoulder surgery, very often we have patients coming from chronic painful shoulder at the consultations and sometimes for stability. So the first indication is very often the impingement, what we call the impingement syndrome, which is a syndrome described by Dr. Neal in 1972, and which is a conflict very specific to the shoulder between bone and tendon. The second more frequent pathology is represented by rotator cuff tears, and especially the supraspinatus tendon. Then the shoulder instability, usually younger patients, or trauma coming for recurrent dislocations. And finally, we'll talk about osteoarthritis, which is cartilage wear at the level of the shoulder, but it's much less frequent than at the hip or at the knee. Of course, we've got open surgery, which is classic surgery with several centimeters incisions, open surgery. But nowadays, in fact, the arthroscopic surgery, which was born 30 years ago, represents approximately 80 to 90% of the overall procedures. So what is shoulder arthroscopy? It's a modern procedure using very small incisions of 3 to maximum 5 millimeters. And through those small incisions, we can insert a camera and also different instruments. We're also working with sterile water, which is injected inside the joint. So the joint is inflated, and it's very easy to have an overall view of the entire joint inside. For those two reasons, very small incisions, sterile water, there is almost no risk of infection during a shoulder arthroscopy. So nowadays, approximately 90% of the shoulder pathologies, when surgery is indicated, are treated by shoulder arthroscopy.